We now return to Illinois Rising, presented by the Illinois Policy Institute, the radio show discussing the honest truth about Illinois policy and politics. Here's AM 560's Dan Proft.
Dan Proft back with Hillary Gowans on this edition of Illinois Rising. Hillary, the Director of Content Strategy at the Illinois Policy Institute. And Hillary, one of the budget-busting issues for states like Illinois, states that were early adopters of Obamacare's Medicaid expansion, taking the perverse inducement offered by the federal government, is the Medicaid program. I mean, we talk a lot about K through 12 education, we talk about public sector pensions, but the greatest general revenue fund expenditure in Illinois is on the state's Medicaid program, and that is only increasing exponentially under this Obamacare Medicaid expansion.
Right, and I think when people think about Obamacare, they don't realize that what they're really talking about is this massive expansion of Medicaid. And in Illinois, that's having really, really dire consequences. So I believe that Illinois' Medicaid program was only originally set up to serve about 380,000 max. Maybe it was a little less than that. And there are projections that we're going to be well above 600,000 people enrolled in the program. So you're right, it's definitely a budget buster. Well,
for more on this topic, we're now joined by Nick Horton. He is a senior research fellow at the Foundation for Government Accountability. Nick, thanks so much for joining us. Appreciate it.
Absolutely. Thanks for having me on. I really appreciate it.
So, different laboratories of democracy took different paths with respect to Obamacare. Some governors, like Scott Walker, resisted the siren song of Medicaid expansion under Obamacare, and the federal government coming in with resources, at least for the first few years. States like Illinois did not resist that siren song, with former Governor Pat Quinn jumping in with both feet to expand the state's Medicaid program. And I wonder kind of what you're seeing in terms of comparison, contrast between states like Illinois and states like Wisconsin in the resulting expense of the federal state program that is Medicaid, as well as the quality of care received by Medicaid recipients.
Sure. So we appreciate the question. We actually just released a new report. We surveyed every single state that opted into Obamacare's Medicaid expansion. And what we found is that every single state with available data that had published projections before they expanded and then have also published at least 12 months of enrollment data, every single one of those states have enrolled more adults than they said would ever possibly enroll, and not just by a little bit. In fact, they've enrolled on average 110% more. So more than twice as many adults as the state said would ever possibly enroll. And the results of this are really quickly becoming catastrophic for states, because starting in January, states have to pay in 5% of those costs. And when you consider that, again, more than twice as many adults as ever expected, coupled with the fact that that's a maximum projection. That's a projection that many states did not expect to reach until many years from now, 2020, 2021, even further down the line in some cases. Now states are already over it by more than double. In the case of Illinois, the state has enrolled, according to the most recent data that they made available, over 650,000 able-bodied adults since the state expanded Medicaid through Obamacare, well more than the number that the state said would ever possibly enroll. And again, Illinois is not exactly a state that's flush with cash right now, over $11 billion in unpaid bills, the worst-funded pension system in the country. Where's that money going to come from? I have a few ideas, but unfortunately, none of them are good.
And Nick, I know that we're talking about state budgets and how this massive enrollment in Medicaid is hurting taxpayers. What are the human costs of this over-enrollment in Medicaid, though? I know you've done some work on what's happening to the people who are actually enrolled in Medicaid and need it the most.
Mm-hmm. Yeah, absolutely. Here in my home state of Arkansas, we have roughly 3,000 individuals with severe disabilities that are on our state's Medicaid waiting list, and we've actually found out recently through data obtained from the state that 79 of those individuals have died since the state opted into Medicaid expansion. And so I did a little bit of digging and thought, I bet this is playing out in other states as well. I bet this isn't a problem that's just unique to Arkansas. What we found is that there are nearly 19,000 Illinoisans as of today that are on the state's PUNS Medicaid waiting list, waiting for needed services. And these are individuals who have needs beyond what Medicaid currently provides for them. They're children with developmental disabilities, they're seniors, they're individuals with severe mental illnesses. And what we found is since the Medicaid expansion was authorized by the General Assembly in Illinois, 12,000 individuals have been removed from that Medicaid waiting list, but just 29% of them have been removed because they got the care that they needed. And in fact, 752 Illinoisans, I'll say that again, 752 Illinoisans have died since the state opted into the Medicaid expansion. 752 with developmental disabilities, severe mental illnesses that are on the waiting list have died before getting the care that they ever needed. And I think it's a moral crisis. It's a disaster.
Well, so, I mean, this is very much like the VA scandal. And so you run a system you can't finance and thus can't manage. And, of course, then the people who are the intended beneficiaries of the program as originally conceived turn out to see their quality of care actually worsen and their opportunity to access care worsen. And so the Medicaid program, I guess maybe just take a step back, is originally conceived for persons with developmental disabilities, indigent children, pregnant women. But when you turn it into an effort to kind of create a middle income entitlement to curry political favor, to curry votes, which is what we've done here in Illinois, even before Obamacare, Rod Blagojevich, the imprisoned governor, was trying to do the same thing through, essentially through the CHIP programs. Then what happens? The intended recipients are the ones that suffer the most because you have healthcare providers that stop accepting Medicaid patients because the state doesn't pay its Medicaid bills because it can't finance the system it's trying to run.
And it really comes down, Dan, to priorities. I mean, you said it perfectly there. You've got nearly 19,000 disabled individuals versus over 650,000 able-bodied adults with no disabilities, working age, ages 19 to 64, that have been enrolled in the Obamacare expansion. Those 19,000 are being left behind. Their needs are not being prioritized. And in fact, again, unfortunately, it's a nightmare to consider, but I think unless Congress does something quickly to roll Obamacare back, and I'm hopeful that they will, this is a problem that's most likely going to get worse because the state's going to have to start paying in 5% of these costs starting in January. The state of Illinois, unfortunately, already has a history of cutting services from the most vulnerable when the budgets get tight, when things get beyond their means, and they have to find money in the budget. They already have a history of doing that. And so states are going to be, states like Illinois are going to be looking for that money in the budget. They're going to have to pay for 5% of, a program that's significantly over budget. The latest numbers are that the Obamacare expansion there in Illinois is 70% higher than promised. State officials, the Quinn administration actually issued some revised estimates on their way out the door that said they expect the state cost to be $2 billion through 2020, more than 3 times as much as they initially expected the cost to be to the state. That's real money. That is not money that Illinois currently has, and it's going to have to come from somewhere.
So, Nick, as we've pointed out in this segment, coverage doesn't equal care, and it especially doesn't work for a state that's already going broke. So what solutions exist for this problem?
Well, I think, the first step, again, is making sure that folks that are qualifying for the program are the most vulnerable. And that's not what's happening in Illinois and in all of these Obamacare expansion states today. You created a new category where, I could go out today. Here in Arkansas, we expanded Medicaid. I could go out today and quit my job and go sign up and enroll in Medicaid. That is not the way that the system should work. That is not the way that the system was designed. And frankly, it's not sustainable. It's bad for the enrollees, as we've already talked about. It's terrible for the most vulnerable because those are resources. I don't need Medicaid. I'm able-bodied. I'm able to work. I'm able to provide for myself. And the money that would go to giving me Medicaid services, that's money that could and should go to those 3,000 folks that are on our waiting list here in Arkansas.
Nick, let me hold you over. I want to pick up this discussion. We're talking to Nick Horton, Senior Research Fellow for the Foundation for Government Accountability. I want to talk about the recommendation that Bill Clinton made at the federal level during the presidential campaign, and that's no. The play is to just push everybody into the Medicaid system. That's the play. Medicare or Medicaid, that's the play. How pursuing something like that would impact the states and what the immediate benefit could be of going in the opposite direction, as we're suggesting, in rolling back that Obamacare expansion of Medicaid. I just wanted to pick up the discussion because the criticism of Obamacare from Democrats, like, for example, former President Bill Clinton during the recently concluded presidential campaign, was no. The play is the problem with Obamacare. The gap is because we're not pushing everybody into government health care. So we need to push seniors into Medicare, and we need to push non-seniors into Medicaid. That's essentially what he said was the solution for the externalities being thrown off by Obamacare. How do you respond to that?
Well, I would respond simply by saying those are programs, particularly in the case of Medicaid, that are already failing to take care of folks who need our help. We talked a little bit about the state level numbers for the waiting list. Already here today, nationally, there are nearly 600,000 individuals that are on these waiting lists. Those are folks who, again, have severe mental illnesses, have intellectual disabilities, they're seniors, they're kids. Those are folks that should be the priority. And instead of taking care of those folks first, what we've done under Obamacare is we've created this new group of able-bodied adults. We've said all you have to do is quit your job and reduce your earnings below a certain level, and you can enroll in this welfare program. States have enrolled.
So if Obamacare is substantially rolled back, including this Medicaid expansion under it, do we go back to thinking about what some reform-minded governors were doing prior to Obamacare? For example, Jeb Bush, when he was governor of Florida, where he sought waivers from federal mandates on the state's Medicaid program in Florida so that he essentially could turn the Medicaid system into kind of a health savings account model to empower people to control their health care costs and manage their own resources that are subsidized by the government for these vulnerable populations when it came to accessing quality health care services.
Sure. I think Governor Bush did some great things in Florida, and I think that is certainly a model that many states could and should be looking at. Again, I would caution and say those are great ideas as long as the scope of the program is appropriate. So, again, as long as you're not giving these benefits to able-bodied adults who could and should be working, because all of the money that will be going to those adults is money that can't be going to the most vulnerable. And we've seen in states across the country, it's a little bit of a parallel in the food stamp program. When states have put work requirements back into effect, they see these able-bodied adults, this same group of folks that are now in Medicaid, when they put work requirements in and folks go back to work, the results are tremendous. They increase their earnings. Their earnings more than double, so they're earning more money now than they were even including their lost welfare benefits. And they're better off because they're independent. They've lost that disincentive to work. Now they're able to take care of their families and advance themselves economically without being dependent on someone else. So I think, again, whatever happens at the federal level, that's a story that we should be encouraging, that we want to see play out, that can play out with these folks that are in Medicaid expansion right now.
So, Nick, you mentioned the momentum at the federal level, and we do, like you said, we have to wait and see what happens there. What will it take in the states for good reforms to take root? Is it, reform-minded governors, a lot of movement in the legislatures, and do you think that people are going to start embracing alternatives like these HSA plans?
It depends. It depends what direction Congress goes. And there's some talk about block grants. There's some talk about letting states keep the expansion for a short period of time, but not letting any new enrollees enroll, and then letting the program sort of gradually wind down, which I think makes a lot of sense and could also work. I would encourage states that are looking for real Medicaid reform to sort of go back to the drawing board and make sure that you're prioritizing the right people. I probably sound like a broken record, but I know that those folks on the waiting list have to be the first priority before able-bodied adults, before people who, 80% of Americans, 80+% of Americans say shouldn't be in welfare at all because they're not disabled. They're not truly needy of help, and they need to be working. So I think as states are looking at Medicaid reform and healthcare reform more broadly, that has to be first priority. And I think, again, even work requirements for Medicaid is also something that's being discussed at the federal level. Giving states the option to put that into their Medicaid program would be a fantastic move that Congress could make more or less immediately.
And you may sound like a broken record, but I mean, that's the crux of the issue. It really is. And Illinois is ground zero for this problem. I mean, it's our biggest general revenue fund expenditure, and yet we're near the bottom in the provision of services to the developmentally disabled. We went from nearly 1 in 5 Illinoisans on Medicaid before Obamacare's Medicaid expansion to now projected to be nearly 1 in 3. That's north of 2 million of our 13 million people in the state of Illinois. And so everything you're speaking about is actually playing out in real time in Illinois. So we appreciate your time. Nick Horton, Senior Research Fellow for the Foundation for Government Accountability. Thanks for being with us and sharing your insights. Appreciate it.
Hey, absolutely. Thanks for having me.